Hello everyone, welcome to yet another session of the daily news analysis by SRIRAM'S IAS, where we take up the important articles featuring in the Hindu newspaper and break them down for our understanding from the examination point of view. So let's start our today's discussion by taking up the important articles from the newspaper, and they are on our screens, and let's take up the first article of the day. Now the first article from the newspaper reads, Launch a National Tribal Health Mission. Now this article is a very important editorial by Mr. Abhay Bang, who also happens to be the chairman of the Expert Committee on Tribal Health, which was instituted by the Ministry of Health and Family Welfare and Ministry of Tribal Affairs. This committee had submitted its report on the 8th of August 2018, and it was the first comprehensive report on the tribal health in India. So it's a significant article written by a person who spent years on behalf of the government of India making a report. So what is the article saying? That it is talking about launching a national tribal health mission. So this particular article particularly talks about the health of the tribals in India and the status of their health in India. So this will become important for us from the perspective of GS2, where we study the policies that are made for vulnerable populations, and we have topics such as issues related to health and education and hunger. So we'll study it from the point of view of GS2. So now what does this article say? Now as we saw, this is written by the chairman of the expert committee. So why was this committee instituted in the first place? The backdrop of why we are focusing on the tribal population right now is that we know that a significant development has happened where a tribal person from the Santhal community has become our president, right? So that has been a major development. Then apart from this, the major push towards focusing on the tribals development is that they account for over 11 crore people in the total population of the country. So out of the 130 odd Indians, we will have 11 crore as the tribal population, which we call the scheduled tribes, which make up approximately 8% of the total population. This is also something which the ruling party is aware of. That is why a tribal person has been made the president. But in the times of where symbolism is also there, if this symbolism gets attached with substance and the real issues of the tribal people are also focused on and are worked upon, it would be nothing like it, where the development of the tribal people will also take place. So similarly, the committee was set up to investigate and to gather information about the living conditions of the tribal people and their problems like the health, education, poverty, which have largely remained out of the natural discourse. So the committee focused on the issue of health and healthcare of the tribal areas. So this is what after the submission of the committee, the author is now writing an article as to what they found out from the report and what are the suggestions that they're making and the recommendations they're making in the report. So the aim was to find out the present status of health and healthcare of the tribal areas and prepare a roadmap for the future to solve the issues as well. And there were 13 members along with the chairman, Mr. Abhay Bang, who is also the author of the article. And this was instituted, as we saw, jointly by the Ministry of Health and Family Welfare and Ministry of Tribal Affairs. And it was submitted in the year 2018. So it's been 4 years, and 8th August is the World International Tribal Day. So it was submitted on the occasion of International Tribal Day in 2018, and it's been 4 years that this report is now out, and the author also questions as to what is going to happen about its application and implementation of the report. So now let's dive down into what this report found out about the tribals of India. So the first important fact that it found out was that first of all, when we talk about the tribals living in India, we know that in our constitution also there is a certain provision attached for the governance of tribal areas, which are known as scheduled areas. They are known to be those areas which have the majority population as the scheduled tribe population. But the startling finding that the report made first of all was that these tribal people, which are said to be concentrated in the scheduled areas, nearly 5.5 crore, which means that out of the 11 crore, almost half of the population of the tribal people are living outside these scheduled areas, which meant that the governance autonomy which is granted and the special provisions that are granted under the scheduled areas, which is under the schedule 6 of the Indian constitution, that was not being granted to the tribal population, and most of them are living outside these areas, which means that in other states sporadically disproportionately spread over other areas. So this was the first finding that the report made. And then the second finding which they made was on child mortality, which meant that the health conditions of the tribal children are also in a deplorable state, where they have been improving in the past years. So there have been improvements in parameters, but there is certainly a gap between the tribals and the rest of India. So as the rest of India has improved in the child mortality, tribal population have not been able to develop or improve in that manner. So child mortality among tribals halved in 26 years, which was 90 in 1988 to 44 in 2014. So it certainly improved, but when we look at the when we compare it to the rest of the India, the under 5 child mortality for the rest of the India was around 39 in 2014, whereas for the tribals it was 57. So this shows that and what do we mean by under 5 child mortality? This would be the rate of mortality of children who are under 5 years of age. So this means that the death of children, of young children who are under 5 years of age can be said to be more prevalent in the tribal population. And why would this happen? Because of lack of good nutrition facilities, because of more diseases these kids that are prone to. So there is a high disease burden as well, where the tribal population suffers from the triple burden of diseases. That is, first is the malnutrition, which would also become a cause for the mortality. The malnutrition data is such that the percentage of underweight ST children have reduced from 54% to around 40% in 2015-2016, but still 40% is also a big number. So 40% scheduled tribe children can be said to be malnourished. So this is a serious condition which needs to be intervened into. Then when we talk about diseases spread, the communicable diseases, which are traditional diseases which need to be taken care of through medicines, and if the medicines are not present, these diseases can themselves prove fatal, such as the diseases like malaria and tuberculosis. These are diseases which are very prevalent in the tribal population, right? But the report also found out that apart from these communicable diseases now, such as malaria and tuberculosis, certain non-communicable diseases as well. What do we mean by communicable diseases and non-communicable diseases? Those diseases which can be spread from one person to another, that would be known as communicable diseases, and those which cannot be spread from one person to another would be non-communicable. So the report found out that there has been an increase in the prevalence of non-communicable diseases as well, such as the hypertension, diabetes, heart attacks. These diseases which come under the non-communicable diseases like cancer and diabetes, those were also on the rise. So the tribal constitutes 8% of India's total population, but they have 30% of all the cases of malaria. So the prevalence of malaria in them is very high with respect to their population. Then even TB is high, where in the rest of India it is 256 per 1 lakh cases, but in tribal it is 703 cases per 1 lakh tribals, almost 3 times the disease prevalence is there. All of this data is in number, but what gist are we getting? That the conditions, if for the rest of the India is bad, for the tribals it is even worse in terms of health, the disease burden that they carry, and the malnourishment and the mortality rate that they carry. So that is what we are able to see. About 70% of the tribal men between 15 to 54 age group use tobacco, as compared to the around 55% of among non-tribals. So even the tobacco use is high than the non-tribals, where it is 55%, and for tribals it is 70%. So this is the condition of health status in the tribal population, which is spread across India, who are not just living in the scheduled areas, but they are living in other areas as well. Then other finding which they make is about the healthcare infrastructure. If all these diseases are prevalent, What about the healthcare infrastructure? We know that as it is, the healthcare spending from the Indian government is not that high. So it would not be much surprising to find out that the healthcare infrastructure in such tribal areas would also not be very sound. So that is what the report also finds out, that these tribal people heavily depend on government public health care institutions such as the primary health centers and the hospitals. Obviously, because no private intervention has been done there yet, so all the healthcare that they will get it from the public sources, and this public institutions are much in shortage, where there is a 27 to 40% deficit in the number of such facilities, which means that there are less primary healthcare centers, there are less hospitals for the tribals, and in these centers 33 to 84% deficit in the medical doctors in tribal areas. No one wants to go in the tribal areas, less and less hospitals are there. The number of medical practitioners who go into the tribal areas, who can take care of the infrastructure, and consequently these diseases can be treated, those medical doctors are absent. So there is a severe shortage of medical personnel in these healthcare institutions in the tribal areas, and on top of that, even the funds are not as high on the spending of these healthcare institutions. So the healthcare infrastructure conditions in the tribal areas as well is also not very good. Then we have the participation of tribals, which means that all of these plan and strategies which we are doing, how much are tribals participating in these planning and implementing of these strategies? So we see that there is very less participation of the tribals, which we can very well make out logically, right? Only when the tribals are able to better their situation in the society, only then will they able to come and participate in the planning process. So the report also finds out that there is hardly any participation of the tribal people locally or at the state or at the national level in designing, planning or delivering healthcare to them. So, and this is also a serious problem, where only when it does not happen that the tribal themselves are taking care of their strategies or how to improve their health, no one will come and will be able to better analyze and better work for them as the tribal people themselves. That is why their participation in these programs is also very necessary, which the report highlights that is not being happening. And then the big question of the funds allocation, which means that those funds which were allocated to be used for tribal benefits, these funds were utilized by states and in some other manner, and no one knows where the funds went. So the official policy of allocating and spending an additional financial outlay, which was known as the tribal sub-plan. This would be the plan under which the certain state governments would be given money, and these state governments should devolve that money to the tribal areas. But this money, which is equal to the percentage of the ST population in the state, has been completely flouted, which means that this money, which was supposed to be benefiting the tribal population, it never reached the tribal population. As estimated for 2015-16, annually rupees 15,000 crore should be additionally spent on tribal health. It was a 2015-16 directive that 15,000 crore should be spent, but no accounts or accountability exist on this, as to where the 15,000 crore which was to be spent on tribal health went. So these are the key findings about the report, wherein we see that there are massive problems with respect to the health conditions of the tribals, malnutrition, disease burden, all kinds of diseases, and on top of that, the presence of health infrastructure is not adequate. There is a shortage of hospitals and centers, shortage of medical doctors who should be treating them. There is no participation of the tribals in the governance process, and the funds allocated for these purposes are also not utilized well, and there is no accountability for these funds utilization. So these are the major findings which this expert committee on tribal health makes out. It's a very important fact that we gather from here. Any question that we encounter in the mains examination with respect to the tribal health, this committee report can be cited. Now, as we saw that this committee was not just tasked with the purpose of finding the problems, but also to give certain suggestions. So what recommendations does this committee make? So this is where the title of the article comes in, that the first major suggestion that the committee made was to launch a dedicated national tribal health action plan or a tribal health mission under which all these aspects and problems of the tribals should be dealt with, and they should be provided financial assistance in this manner, with the goal to bring the status of health and healthcare at par with the respective state averages in the next 10 years. So within the next 10 years, those parameters which are there for the other residents of the state, those should be matching with the tribal population. Then secondly, the committee suggested nearly 80 measures. So there is a long list of measures that can be taken place with respect to the tribal health, improving their health. 80 measures to address 10 priority health problems, that is the healthcare gap, the human resource gap, and the governance problems. And thirdly, the committee suggested allocation of additional money so that the per capita government health expenditure on tribal people becomes equal to the stated goal of the national health policy, that is 2.5% of the per capita GDP. What does this mean? That under the national health policy, we have made a target of making our health expenditure equal to 2.5% of the GDP of India, so that the amount of money that we're investing in the health infrastructure increases. And the committee makes a recommendation on these lines that as it is there under the national health policy, the money allocated towards tribal healthcare as well should also be increased, and the money that is going on for each tribal and their healthcare services should receive that much enough money, and they should receive the adequate services that should be meant for them. So in this way, the author tries to make use of this situation where the conversations on tribal population in India has gained a new momentum, and it, as I said earlier, the symbolism or the acts of going a tribal person in the post of the president is happening. If substance and real interventions with respect to tribal population also follow this symbolic gesture, then it would be nothing like it, and the problems of tribal population can be highlighted and solved through these interventions. So with this, we finish this article, and let's move on to the next article for the day. The next article now reads, panel bats for equality in child's guardianship. Now this panel is the parliamentary committee. We saw that yesterday was the last day of the parliament session, and in this session, the parliamentary committee suggested certain changes in the Hindu Minority and Guardianship Act, right? So this panel suggested certain changes, and these changes are quite significant, and these changes relate to the ownership of the child or the guardianship of the child by the mother or the father, and who should get the priority. So these issues can get important for us from the point of view of GS1, where we study society and issues of gender, and can be also important from GS2 perspective, where the law aspect of the same theme can be asked. So what has the panel suggested under this act? So earlier, the Hindu Minority and Guardianship Act, it accorded superiority to the father in case of guardianship of a minor. So let's say that a couple is separating via divorce, and in this case, when the separation happens, when the question comes of who will be the guardian of the child, this Hindu Minority and Guardianship Act accorded superiority to the father, which meant that in between the conflict between the father and mother, the preference would be given to the father of the custody of the child. But this is what the panel is suggesting, that it is an act of inequality, and the act was made much earlier, and the times are changing today with the financial conditions of women changing, the grounds for divorce changing, where the divorce is happening via mutual consent. So in the wake of all these new developments happening in the society, the parliamentary panel is suggesting that this superiority aspect of the child custody given to the father should be done away with, and it should be granted equally to the mother as well. So, and under the religious law of Hindus or the Hindu Minority and Guardianship Act of 1956, the natural guardian of a Hindu minor in respect of the minor's person or property is the father, and after him the mother. So this has been what is asked to be changed, where the mother should not come after the father, and they should be getting equal treatment in terms of the custody. Then, which is provided that the custody of a minor who has not completed the age of 5 years shall ordinarily be with the mother. This was earlier the case where if the age of the child is less than 5, then the custody used to be with the mother. So this is the changes that the parliamentary panel has suggested, which are quite significant changes, and now it remains to be seen whether these changes suggested by the committee are implemented via amending the Hindu Minority Guardianship Act, right? So this was the important point with respect to this article, and with this let's move on to our next article. The next article now, which features in the newspaper, reads about the Consumer Confidence Survey. Now this Consumer Confidence Survey we've taken up in our earlier sessions, and so the Consumer Confidence Survey is carried out by the Reserve Bank of India every few months, and it tries to gauge the consumer sentiment with respect to the economy, as to what they feel about the spending of the economy, what is their perception about the economy, is it going down, is it doing well or not, and what is the stature of their income level, spending level. It tries to gather information about all of it, and since the RBI does it and it collects data, it can be an authoritative document for collecting the data from of the Indian economy on these vital parameters. So let's understand some important pointers about the Consumer Confidence Survey report by RBI and what are its key findings this time. So it is conducted by the RBI every couple of months, and it is conducted in 13 Indian cities. So the coverage we can see is not very wide, but only sort of, one can say, limited to 13 Indian cities. So, and it conducts this survey every couple of months by asking households in these major cities about their current perceptions and future expectations on a variety of economic variables. And what are the dimensions of the survey? They include economic situation, employment, price level, income and spending within the 13 covered cities. So we'll see the data which has come on this now, and it basically surveys the perception of Indians about the present economic situations compared to a year ago. So as we can see, this survey is based on the subjective analysis of the households as to what they feel about the economy, what they feel about the growth and decline, and what has been their experience in terms of their income spending and rise in their income, right? So what has been the development? Let's see. The first graph talks about the economic situation, where the survey asks them about what their perception is about the economy. So in the period of May 2021, which was the peak time of COVID going on, 80% of the consumers who took the survey were of the opinion that the Indian economy is in a bad shape. So they said that the general economic situation has worsened, right? So this was the opinion of the 80% people. But this time, by March 2022, this share has now gone to the 62% people, which means that now the situation is bettering, with the situation which was bad earlier, where 80% people said that the economic condition is not very good. Now the same is felt by a less percentage, that is 62%. So this graph, as we can see, in May 2021, it was quite high in terms of how bad the situation is, and it is now decreasing. That is the first data with respect to the state of economic conditions and what people feel about it. Then second is about the employment scenario. Now, how many people are enthusiastic or encouraging about the employment? How many of them are finding the employment? So it was observed in the earlier survey that the share of urban consumers who said that they were worried about the employment scenario rapidly declined after the Delta wave, which again means that in the peak time of COVID, the share of percentage of people who said that the employment scenario was bad is also now improving slightly, wherein in the last two editions, the decline in pessimism has been arrested. So in May 2021, higher percentage of people found difficult for seeking employment, and then it decreased, but it has certainly now plateaued at a point where one can say that this decline which was happening is arrested. Or now, as more and more people were feeling positive at this point of time, now it has certainly gone down for some people. So this is with respect to the employment scenario. Then the other point is about the price levels. This is about their income spending, which means that how many people are there who feel that the prices of the products in the economy has increased. So the share of urban consumers who said that the price levels have increased compared to the last year continued to be above 90%, 95%. So 95% or nearly everyone who took the survey is agreeing that the price levels of the products are increasing. This is a very obvious fact. The inflation is increasing. So obviously people who are spending their income to buy products will feel that the price levels are increasing, and this is continuously increasing for the number of consumers who feel that the price levels are increasing. Then the last data is about the income and spending, as to what people think about their income levels and what is their rise or change in the spending levels. So in terms of the income, people have felt that their incomes have been rising by some amount, but their spending has is rising, or can say has increased to a larger extent. So the share of urban consumers who said that their income levels have increased began to increase gradually, right? So people are feeling that their income levels are increasing slightly, but the last two editions shows that this increase has stopped in the income rising. So this has stopped to a level, income rising has stopped, but the income spending, which is to be done for all kinds of buying the amenities, buying services, that has continuously gone up. So this shows the perception of people and their practices which are going on in the economy, and with this it can certain data can be collected as well. So what is the significance of this survey? It indicates how optimistic or pessimistic consumers are about their expected financial situation and the future economic situation of the country. So this kind of data the RBI is able to collect from it, and optimism will mean growth in demand leading to more production and enhanced economic growth, right? So this data can fuel the respective industries wherein demand is growing, and it can fulfill that demand for these consumers. And pessimism will mean poor expected consumption leading to reduced production and low economic growth. And the key driver of economic growth is widely considered a leading economic indicator of household spending on consumption. So these are the important inferences that one can make out from the data, and this helps in monetary policy formulation, right? So monetary policy is that policy which the RBI formulates. So by the data that RBI is collecting, it can formulate, it will get help in formulating its monetary policy, right, in relevant discussion as per the market expectation and push and pull factors. So this is the significance of the consumer confidence survey, which we should remember is taken out by the Reserve Bank of India. So with this, we finish this article, and let's move on to the next article for the day. The next article now reads is Agnipath NPR raised during the 0 hour. Now 0 hour, as we must have seen in our static books as well, is an important concept in the concept of parliament and its various aspects that we see. So this becomes important for us from the point of view of GS2, right? So what is 0 hour? What do we mean by 0 hour, and where does it take place? So 0 hour is a span of question answer round in the parliamentary proceeding. So whenever the parliament is going on, the 0 hour is also conducted, and what happens in this 0 hour? Let's see. So this 0 hour is an Indian parliamentary innovation, which means that it was not there earlier, or it is not a part of the British parliamentary system. This is a special innovation which has been the case in India only, and it is not mentioned in the parliamentary rules book. This is a very important fact that we need to make note of, that this is not mentioned, since it's a custom that has developed by practice. It is not mentioned anywhere in the rule books, but there is a similar concept which we study, which is what? Question hour. How is 0 hour different from question hour? So question hour is the round of asking questions to the members of parliament and ministers, but this is mentioned in the rule books, and it's a sanctioned time given in the parliament. But 0 hour is a informal process that follows, wherein a certain time period would be granted in the house where anyone can ask a question to the minister or concerned person in the parliament. So under this, MPs can raise matters without any prior notice. Since it's an informal discussion, if anyone wants to ask a question in the parliament in this 0 hour time, they can do so without any prior notice. But when it will come to the formal question hour, one has to submit their question 10 days prior, and then that question would be taken and it would be replied by the concerned minister or member of parliament. But since it's an informal procedure over here, in the 0 hour, the ministers are not liable to reply to the issues raised during the 0 hour by the by any member of the parliament. So this becomes the difference, that since it's an informal process, the liability to reply as well for the minister is not, they do not have any liability. Then it starts immediately after the question hour and lasts until the agenda for the day, that is the regular business of the house, is taken up. So this means that this is when the proceeding starts, all of this is happening before the real proceeding is starting. So if at 9 o'clock the proceeding is starting, 8 to 8:30 is the question hour, and then 8:30 to 9 would be the 0 hour. This is the timing for the 0 hour, and in other words, the time gap between the question hour and the agenda is known as the 0 hour, right? So these are the important points related to 0 hour and how they differ with question hour, right? So I hope this concept is clear. We finish our important articles from today's newspaper, and we'll meet again tomorrow with the important articles from tomorrow's newspaper. Thank you.